Hello, and welcome to another episode of Road to Rehabilitation. Something that has been bothering me is why do kids drool so much? Why there is so much saliva seeping out of their mouth? It's just that they're not aware that the saliva is coming out, that they need to control it. So, of course, why can't they control it? They're not closing their lips. There is some problem with the dentition. There is some problem with the movements of the tongue or the lips so that the mouth again remains either open or the control is not there. They cannot push the saliva back to swallow, or there can be a reduced sensory awareness, like the sensation inside the mouth is not good enough, that the child understands that there is saliva and I have to swallow it, so that automatic process somehow is affected, which can also happen if your child tends to have problems related to their muscle tone. It doesn't only affect the limbs but also the mouth. Some kids tend to have a deep mouthing issue. They want to mouth everything, put everything in their mouth. That could also lead to sort of the production of saliva so much that they're not able to control it, and the posture of the child, the head lolling down all the time, and then of course it leads to saliva all around. So we can see the problem here is not that the child has extra saliva in the mouth, but more like the control is not there, either in terms of swallowing or either in terms of the place where they have to stop the saliva from coming out the mouth. So how severe the saliva problem can go? The lips could be wet, first level. Then it can go to wet chin, the next level. Then it can come down to the clothing. It's usually wet, especially the collars. And the most profuse form would be hands, anything around the table, everything remains wet all the time with the kid. Now we all know the theory of this drooling. The important point is how to try to control it. And in order to control it, there are some very simple steps that we can follow. First of all, if you know there is an underlying problem, like the dentition is problematic, there is some obstruction, medications are causing it, we can always control that. We can control the posture or the seating of the child. Try to avoid the positions where the drooling tends to happen more. The head has to be upright rather than lolling down, or the back has to be arched straight rather than, that curved kind of spine which tends to bring the head forward, not encouraging lip closure, and as a result drooling and wetting the surface on which the child is sitting. So the posture can be controlled. Next, the control around the lips can be facilitated. There are so many things that are used. For example, general lip closure, asking the child to suck or, suck on or hold like a spoon between the teeth, and not the teeth exactly, but the lips, so that the lip closure tends to happen, holding it for a few seconds so that we can facilitate that part. Other similar kind of techniques can be, you can ask the child to try to suck with a straw, starting with thinner liquids and shorter straws which are easier to manage, and then moving on to thick consistency liquids, and then moving to longer straws, so that extra effort has to be placed in order to suck the thing inside, and you will ensure that the child has closed the lips. For a slightly older child, asking the child to swallow frequently or keep wiping the face frequently, along with movements related to tongue, lips, jaw, their closure, tongue movements from side to side, backward, enhancing the swallowing, they can be practiced better. Now, if the child has a habit of mouthing too much, which is more of a reason that the child drools or saliva comes out of the mouth, well, you can always control the mouthing. Find out why the child is mouthing. First, it could be some kind of sensation they more of need in the hands rather than actually in the mouth. So you can keep the child's hands busy, put some gloves. So these kind of sensations would relax the child more so that the child does not put the hands in the mouth. Secondly, if the mouthing is related more to objects, then in that case, giving the child alternatives of things that they can put in the mouth which are more healthy, which do not lead to excess saliva, so sweets tend to be avoided over here. And giving more gentler things, crunchy kind of food, which will help the child to bite it, also enhance the chewing, and finally swallowing the food. And with that, the saliva goes inside as well. Then finally, simpler techniques can also be applied for a child who is more cooperative, like giving visual cues as to, do you feel something around your mouth, or the child touches and finds it, like wiping I mentioned earlier, or giving auditory cues repeatedly, you need to wipe your mouth, or is your mouth closed, things like that. These kind of small hints can make the child aware that yes, I need to control. And finally, reinforcing. Every time you find there has been a considerable period in which the child has not resorted to drooling, always try to reinforce, and not with candies, but again, the reinforcement has to be done more with, in terms of good job, or you did a great thing, or giving stars to the child, or creating a wall in which stars or any such kind of stickers that the child enjoys can be placed, so that the child looks forward to it. And once the child has collected maybe 3 or 4 or 5 of these stars or stickers, you can add a bigger reinforcement at the end of it. Some extra or compensatory techniques could be taught to the child. For example, putting a scarf around the neck when the child tends to wet their chin or their upper part or collar of the shirt, so that it doesn't get wet very frequently, and the scarf can be changed, of course, replaced. Same thing can happen with some simple vests that can be put on, like simply a buttoned or a velcro one, which is easier to change, put on the main clothes of the child. And finally, putting some cuffs or handkerchief tied around the wrist, so that the child simply has to wipe with it rather than looking for the handkerchief all the time. Very simple techniques, but you can always control the drooling of the child in this way. And as I always recommend, seek the help of a rehab professional, an occupational therapist, or a speech therapist that you are going to in this matter, so that you can manage this drooling problem of the child, no matter what the cause. The child has behavioral issues, or the child has some physical problems. It can always be managed if you approach the rehab professional at the right time. Don't delay it. That's the takeaway message. If you like the video really, please leave a like, subscribe to the channel, add a comment. How do you feel about this video? Any different suggestions about videos that you would like to make? Ring the bell icon for notifications about my videos. Watch my previous videos, and we will meet again.